Hi guys, the next video I'm going to do is giving a back massage, and this starts the skills in Unit 3 G1. Supplies: bath blanket, bath towel, lotion. Again, step 3 is those identifiers. Step 4 is performing hand hygiene, so they want to use the hand sanitizer. We also would like them to make mention that they don't need gloves if the skin is intact. So facilitating lab instructors, please make sure that you're explaining in step 4 that besides hand hygiene, they need to make reference to that if the skin is intact, they don't need gloves, but if there is a breakdown or opening, that they do. That's step 4, and that's a critical, so please, please, please let them know that. So they need it. So like if their patient, they went in there, did hand hygiene, and they would say, their patient, my patient's skin is intact, so I'm not going to use gloves. Or they may choose to say my patient has, open areas or just kind of scaly skin, I guess. I don't know. Something that they say that they would wear gloves. And then what would be really good is if they said, oh gosh, would I use lotion if they had non-intact skin? Wouldn't that be great if someone said that? Hopefully we get someone that says that. Step 8, they can be prone or side lying. Step 9, expose the back, shoulders, upper arms, cover the rest of the body with the bath blanket. Laid the towel along the back, so much like we've done before. Did this if the person was side lying. Warmed the lotion in the hands. Again, talking to that patient, explaining to them that this may feel cold or wet, and then applying that lotion to the lower back. Stroked up from the lower back to the shoulders, then stroked down over the upper arms. Stroked the upper arms across the shoulders, down the back. Used firm strokes, kept your hands in contact with the person's skin. And again, if they're doing some sort of a movement, like that, or even if they ask the patient, well, what areas, where do you want me, it's going to be okay, because then they're directing it to the patient. And then step 16 is kneading the back. Grasp the skin between the fingers and thumb. Knead half of the back. Start the lower half and move up to the shoulder. Then kneaded down from the shoulders to the lower back. So you're going up and then down. And then repeat it on the other half of the back. So you're on one side, and then you'd repeat, and then they come down, and then repeat on the other side. Applied lotion to bony areas. Use circular motion with the tips of your index and middle fingers. Do not massage the reddened bony areas. So again, this one isn't critical, but they need to talk about, to get that point, they need to say what that would look like if they saw something red, and that they wouldn't massage that. And for step 18, it talks about using those fast movements to stimulate. So facilitating instructors, when you're doing peer checkoffs, to have a discussion with them. Why would we want to do fast motions to stimulate that? We want to increase that blood flow to that area. And so maybe there's something we're, stimulating to where we're, and then we're using this, that slow is more to just kind of relax that person. So let them know the difference between that. And then stroking with long, firm movements to end the massage. So down, that up and down. They can do it similar to what we've did before. And then again, letting the person know that we're almost finished. Straightened and secured clothing or sleepwear. Covered the patient. Remove the towel and blanket. Place the call light. And again, when they're removing that towel or blanket, you may have to tell them, make sure that it's getting put in that linen. because step 27 talks about following the agency policy. But you may have to, facilitating instructors, let them know when they remove any dirty linen, we can't set it anywhere other than in that linen bag. We don't want to set the dirty stuff around. So be letting them know that stuff. Step 22 is the call light step, and that's a critical. And I think everything else is pretty much self-explanatory. Step 29 is reported and recorded your observations. Again, if they tell you that they recorded and reported it, ask them, what are some things, if you were doing a massage, what are some things that you would report and record? And hopefully they'll give you answers like those reddened areas, or did they have pain, or, you know, something to that effect. Those are the things that, you know, those open areas, pain, inability to relax, just, you know, very tense, muscular knots, you know, whatever that looks like for that patient. Those are the things. So that concludes giving a back massage. Let me know if you have any questions. And again, I encourage you to reply to this video and in this discussion, and let's get some great conversation started. Have a great rest of the day.